Welcome back. In this video I'll be teaching you the pathophysiology of acne and how we treat it. And I'll be teaching you everything that you need to know for the USMLE exam. First we'll need to understand the pilosebaceous unit, and this includes from the name pilo means the pili muscle and sebaceous meaning the sebaceous gland next to the hair follicle. So the pilosebaceous unit is formed by the pili muscle, the sebaceous gland and the hair follicle. So in other words, each hair follicle is combined by at least one sebaceous gland and at least one pili muscle. Alright, so after we know what the pilosebaceous unit is, let's see how acne forms. The first step is always plugging that prevents the sebum from leaving the pilosebaceous unit. The plug could be formed by bacteria or makeup or desquamatized cells or whatever, basically anything that would prevent the sebum from leaving the pilosebaceous unit. And then the sebum will build up inside the pilosebaceous unit, and this increases by the action of androgens, so patients with high androgen in their body have increased chance of forming acne, because androgen will stimulate the pilosebaceous unit to secrete more sebum. And this sebum is a very good medium for bacteria, especially the Propionibacterium acne. Now this bacteria has lipase, which will convert the sebum into free fatty acids that will irritate the skin to cause inflammation. Also, this bacteria produces pro-inflammatory mediators like interleukins, which will also cause inflammation. So the stages of acne is as follows. First we'll have the plug, and then as the free fatty acid builds up, it's going to form what we call a whitehead or a closed comedone. And then air is gonna get inside the pilosebaceous unit and oxidize this free fatty acid to form what we call a blackhead or an open comedone. And then it's gonna form a pimple and then a pustule, which basically has the bacteria. So pimples and pustules, or acne as we call it, these two stages include inflammation or has inflammation inside them. By the way, before we continue, if you want to know how to differentiate between papules and pustules and nodules and cysts and plaques and whatever, I've made a video in this channel that helps you to describe any skin lesion that might come in the USMLE exam. So you can check it out by clicking on here. If we want to classify the severity of acne, mild acne has comedones, moderate acne has papules and pustules and sometimes causes scarring, and severe acne, also known as conglobata, has cysts and will always cause scarring. And here are the list of medications that can cause acne. So basically medication-induced acne. And finally, to treat acne we use isotretinoic acid, which is a vitamin A derivative, and it's very important to know that it's highly teratogenic. And for pregnant women with acne we use either erythromycin or minocycline. And for other treatment of acne, we use peroxides, we use sulfur derivatives, we use salicylic acids, azelaic acids, and glycolic acids, and sometimes we use oral antibiotics. Before I go, I want to thank all of you for 800 subs. This is really mind-blowing and so surreal. I never thought the channel was gonna strike up real quickly like this. Don't get me wrong, it's a very good thing, I really like it. And hopefully I'm gonna be able to help you guys, and obviously I'm gonna continue making videos. And I just want to thank all of you very much from the bottom of my heart. This really means a lot. And yeah, see you guys later.